I feel desperately sorry for people awaiting treatment. 7.4 million people waiting for elective procedures. The strikes already have added another million to this. I've just seen the clip, actually, of Vivek Trivedi and also Rob Lawrenson talking about why they are embarking upon yet more strike action. They've been told this is a final pay offer, which the independent pay review body came back at 8%. They want 35%. It's not going to happen.
No, it's not going to happen. I mean, what we're seeing, I think, David, is obviously the story today of the Labour Party and the Liberal Democrats are weaponising, as I think Ed Miliband called it. They're weaponising the NHS in advance of the election next year. And I think the BMA in particular are doing their job. They're playing their part to support them in that. These are political strikes. They're designed to undermine the NHS, damage the NHS. I've said to you before, actually, it feels to me like kicking a wounded animal, you know. We know the NHS was put under tremendous pressure after virtually sort of shutting itself down during the COVID period for the best part of a couple of years. There are many people now who are frightened to go to their GP, people who have been waiting for scans for a long time for diagnostics. And I think we're now seeing the results of that. And really, I really do feel that the BMA are encouraging doctors to really demean their profession by the way they're behaving. The 35% claim is a ludicrous one. It's never going to be met. It's not even going to be half met. So where does it go? It can only mean that, I guess, the situation will get worse and worse.
Any more detail on what kind of treatment these people were waiting for? As awful as the statistic is, obviously it's released by Labour and Lib Dems. But when you say somebody's waiting for treatment, is it they died because they were waiting for treatment, or does it so happen that they were waiting for, I don't know, to see something that was not life-threatening, and then ended up dying of something else entirely?
My father-in-law, who was 94, was on a waiting list to have a cataract operation. Oh. He really wasn't well enough to travel to go and have this operation. He was in a care home. He didn't die of COVID. He died really just because he was very old and got pneumonia in the care home. Absolutely nothing to. He was on a waiting list, yes, to have a cataract sorted. And I think this is one of the core issues. There's a lot of data flies around the NHS. When I worked there, you know, we had sheaves and sheaves and sheaves of charts and graphs about every minutiae that was going on, and I think everybody was getting a bit data fatigued. I look on some of these things. It's a very good point. I look at some of this data a little bit like a piano. You can sort of play any tune you like on it, and I don't think a lot of these people died because they were waiting for treatment, but it was a reality that they were. And of course, the level is unacceptable.
Yeah, of course.
And the NHS in their organisation, the way they work, the way they worked through the COVID period, need to accept responsibility for that. But it's not quite as black and white. All these 300,000 plus people, I don't think they're all lying in bed in pain and agony, as Mr. Streeting would like us to think they are.
And I think you're absolutely right. The whole thing's been weaponised out of all proportion. I heard yet again political parties saying it's about money. It's not about money. We spend 11.1% of GDP. That is more than the European average. So it's not about money. The money does not go to the right places. And my friends who are consultants say they are browbeaten by the amount of management, administration, people walking around with clipboards. They're not allowed to do their jobs, which is caring for patients.
So if we can let local organisations, and many of them are well run, in fairness, David, I have to praise my local services, both in primary care and in secondary care. The quality of the service is very good. I mean, I had to see my GP about something yesterday. I got a same-day appointment. It was very straightforward, very effective. So there's a lot of good organisations, but we've got to liberate them, let them get on with it. Not all the managers are bad.
Indeed.
There are some very good managers, former clinicians who are managers. So I think it's a question of NHS England loosening the reins, and that means the politicians backing away from it. Their role should be more strategic, particularly due with public health and health prevention, bad health prevention, all of those sorts of things. But I do think that they need to be liberated to get on and sort things. I think as well, when it comes to people on waiting lists, I do think the NHS are reasonably good at a local level in prioritising those who need that care the most.
And Martin, earlier this year in January, Rishi Sunak made cutting waiting lists one of his top priorities. He then admitted that this has stalled, but he said that this was because of strikes by doctors and sort of solely strikes by doctors that these waiting list numbers had increased. Do you buy that?
Not altogether,
no.
But obviously the doctor strikes haven't helped.
No.
But I still think we are suffering from the hangover from the COVID period. Look, people were scared witless, elderly people particularly. We know people who didn't go out for 2 or 3 years, didn't leave their homes. And they're now, even now, beginning to pluck up the courage to go and see their GP because they've got a lump or a bump or they're suffering in some other way. And I think we're seeing the waiting list grow more, partly because still of the hangover from the COVID period.
Absolutely. You and I have spoken about this. We have gone from 300,000 beds down to 140,000 beds. The money simply isn't in the right places here. And just in terms of this, I'm sick and tired of it being a political football where one political party says this, another one says something completely different. We need to depoliticise it. We need a 20-year strategic plan, don't we?
Yes, we do. I mean, I slightly question the point about beds, David, because in fairness, over a period of probably 20, 25 years, many more procedures are being done in daycare in one day, and people are having chemotherapy and all sorts, and just going into the hospital and not needing a bed. But I also think, and I worked in community and mental health trusts where we were working hard to try and keep people out of hospital. Let's get the community nurses doing what they could do, work in very close cooperation with the GPs.
But as you well know, Martin, also we have a big problem with bed blockers because we don't have enough social care, so therefore we can't get people out of hospital, therefore we can't admit, and that's why you get the backup in A&E, and that's why they're in the back of the ambulances.
And that is absolutely true. And I think the social care situation is a disgrace. I'm not even sure that should be in the hands of the government or certainly of politicians. I think social care are local issues, but again, you've got to free people up. You've got to free local organisations up to get on and do the things they need to do. It's not awful everywhere. Now, the Lib Dems are talking about postcode lotteries. That's rather an old hat thing, isn't it? If we ever think the NHS care, however it is structured or reformed, is going to precisely match in central Liverpool to that in sunny Surrey, I think you're probably deluded. It's not. We want good care everywhere, but I think people have to recognise that there is going to be variation. Now, I mean, we have a relative in Wales, and if we think we've got problems with the NHS here, we have a relative who's been in pain since January, severe pain, that's been passed from pillar to post, referred to this one, referred back to that one, a scan of this, an examination of that, and she's no better than she was back in January. If anything, she's worse. The NHS in Wales are now asking to take more of the beds in England for their patients because they haven't got the capacity. Now, they're run by the Labour Party in Wales. So if we want the Labour Party here, let's look at Wales because it's worse.